The Robert Wood Johnson Health Policy Fellowship and the fellows have been involved materially in every major health policy initiative that's gone on for the last half a century in the United States of America. So that is a legacy that just incredible.
The Hill, the offices and committees of Senate and House and even White House get smart young people who often are the only one who know about healthcare sitting along with policymakers.
I mean, it's interesting, these offices make up our healthcare policies, our healthcare programs, our healthcare laws, and there's very little advice from people who actually practice medicine.
If we go back to the 70s, the presence of a physician on Capitol Hill was unusual. I think the foundation probably saw it as a leverage point that they could make an investment not only in career development, but they could also make an investment in terms of improving the quality of the debate and the quality of the analysis around healthcare programs.
Now we get bright, brilliant, mid-career individuals who says, I want to come and learn about policy, especially in DC on the Hill. So that's a tremendous experience for them.
For the fellows, this is just an unparalleled opportunity to learn, really get steeped in the policy process at the federal level.
Getting people who are content experts or who understand what is important in health to become more aware of how policy is created and how policymakers actually work is essential. We need people who understand what the problems are and what the potential solutions might be to be able to speak the language that policymakers speak.
Well, I would say to people considering this fellowship that health policy is a medicine and surgery for what ails the population. And physicians, nurses, other clinicians see one patient at a time, honorable work, wonderful work. But if you have a chance to save an entire population with a single health policy, you should do it. You can change the direction of the battleship when you go after the right health policy. It's irresistible as a clinician to fix things for an entire population.
And we get to provide this opportunity for all of them and see a whole cadre, generations of leaders coming through. So it's a win-win-win for the fellow, for the Hill, for us, of course, for the nation.
It transforms us as individuals and how we can actually transform the fields that we're in. And we are then transforming the people around us, our students, our colleagues, our communities, and we're transforming policies as a result of this experience.
Policy requires elegant solutions, not sort of crude, just do this kind of thing. And so taking a professional background and adding to it the nuts and bolts of how policy works to create elegant solutions to problems that we're facing in our country, I think is essential.
Marie Mitnick says at some point early on, so you realize that now you've committed to spending the rest of your life making healthcare better for the United States. And I thought, oh my God, was that in the application? I didn't realize that. But I have spent the last 10 years trying to do exactly that. And I could never have made that contribution without the fellowship. So thank you very much, and may it continue for many more years.